This is not medical advice. This is a news update to the coronavirus situation in Asia, focusing on Vietnam, Thailand, Japan, and Korea. Hopefully, you find this information useful in making your travel plans or at least interesting. I suggest people have travel insurance for health and flight coverage. Before I begin the essay, let me stress wash your hands. That's probably the most important habit to develop to prevent the spread of coronavirus and other diseases. Let me start by briefly talking about the situation in mainland China. China's current case total is over 76,000 for mainland China. The Chinese figures are surely inaccurate for several reasons. First, they have changed their diagnosing criteria recently. I'm suspecting this is because testing everyone with minor symptoms has become a low priority in these harder hit areas. Also, supposedly, the testing kits have been inaccurate at times, and I would just assume there's a shortage of these kits in general. Finally, I'd also assume that many Chinese citizens are avoiding reporting symptoms if they're not severe, just in fear of what their government might do to them. I think there are a large number of unreported cases currently in China, so overall, I suspect the Chinese case totals are inaccurate and not a good indicator for the spread of the virus. On to Vietnam. With 16 cases of coronavirus, I've been more concerned with physical security rather than coronavirus. Since arriving in early February 2020, I've been more worried just about getting mugged or something stolen from me in Vietnam rather than catching the virus at this time. The Vietnamese people and government seem to take the situation very seriously and are taking measures to avoid an outbreak. China is a neighboring country, but Vietnam has restricted travel to China. I haven't gone mask shopping in Vietnam, but there doesn't seem to be a complete shortage. Hand sanitizer is available but scarce, and I can't compare it to previous prices, but it seems pricey. If I recalled, I paid nearly $10 for $10 for a couple of ounces. I've seen a couple of reports claiming hotels are temperature screening customers in Vietnam, but I've seen no evidence of this. But the service department I'm staying in this week did provide me with a bottle of hand sanitizer, hand soap, and they have surgical masks available for their tenants. Don't expect this everywhere. I personally don't wear a mask daily, except for airports, but while in Vietnam, I seem to get some weird looks if I don't wear a mask. Keep in mind the Vietnamese government seems to be aggressively handling the situation, so there is a chance of quarantine. In my last update, I mentioned how Vietnam quarantined an entire region of over 10,000 people in Son Loi, northern Vietnam. It hasn't happened everywhere, but again, they don't seem to be taking any chances. Also, speaking of quarantine, I can't predict that if you return that your own country won't quarantine you or require you to self-quarantine. I'm even considering self-quarantine when I return. There are some possible issues with this. One is that it seems that on the Diamond Princess, the passengers of that cruise ship were quarantined, but it didn't seem to stop the spread of the virus. So if I were to self-quarantine in a hotel or Airbnb, I don't know, would I end up spreading something? I'm not sure, but I'm not symptomatic, by the way. So many people who have the virus weren't symptomatic for weeks anyway, so that's the point of quarantining. Now, recently, Japan had a significant jump in cases. Some of these numbers may have been due to the Diamond Princess cruise ship, which behaved more as an incubator than a quarantine. Japan's total now sits at 105. According to an article from the Japan Times, a substantial transmission of the virus occurred before the Diamond Princess quarantine. The National Institute of Infectious Diseases, basically the Japanese CDC, seems to suggest the rate of transmission was curbed due to the quarantine. I have my doubts about the effectiveness of the quarantine, especially without a control subject for comparison. Speaking of which, I'll mention the MS Westerdam soon. A few countries have evacuated their citizens from the ship, but many remain in quarantine until they're cleared to leave. As for the Diamond Princess cruise ship itself, don't worry. Once this is over, Carnival will give it a scrub, and it'll be ready and waiting for you. It'll be ready April 29th, 2020. So just in about a month. No worries. It's a bad joke, I'm sorry. But it will be ready April 29th of this year. Thailand's current case count of coronavirus is 35. So that's not a massive leap from what they've seen in the past. That's only about 1 or 2 cases in the past week. Already out of those 35 cases, 15 have recovered and returned home. So talking about cruise ships again, it turns out Thailand was right in their decision to refuse the MS Westerdam to port. One passenger was diagnosed with coronavirus. So remember when I said earlier that if the Diamond Princess had a control, well, maybe the MS Westerdam was the control. So like I said, an 83-year-old woman tested positive for coronavirus in Kuala Lumpur. She was one of the passengers aboard the MS Westerdam. If Japan's National Institute of Infectious Diseases is accurate in their assumption that substantial transmission occurs prior to quarantine, and that woman was positive for coronavirus on board the MS Westerdam, then we should expect to see a spike in cases from those aboard the vessel. Of course, these situations between these two cruise ships aren't the same. If passengers of the Westerdam were infectious, then I would expect the case count in Cambodia to skyrocket. And, I say this because the passengers of the MS Westerdam were greeted with hugs and flowers from even the Prime Minister of Cambodia, and they were encouraged to tour the city. As it stands today, it seems that the 83-year-old woman was the only one infected. So the Westerdam was a concern for Thailand because of a potential outbreak, but the cruise ship itself docked in neighboring Cambodia. Like I said, and 27 of those passengers have already entered Thailand. In my last update, I expressed doubt that Thailand would be able to track the MS Westerdam passengers who entered Thailand, but they have. Those passengers have reportedly tested negative for the coronavirus. Probably the biggest news of this update is that South Korea had a very sudden spike of 142 cases, bringing their total to 346. Yeah, my flight out of Vietnam has a layover in Korea, so I'm not looking forward to that. Apparently, some cult has been spreading the virus inadvertently. About 100 cases have been traced back to the sect, 38 of those recently. I have no idea what's going on here. Is the sect large? Do they worship in a cramped, confined space? Are they drinking from the same glass? Does no one wash their hands there? Are they like sneezing on each other as a greeting? I don't know. What do you think? Were they just being unhygienic, or was it something else? On second thought, don't comment on that. So out of that spike of 142 cases, 92 have been traced back to Daenim Hospital in Cheongdo, Korea, which, yeah, it happens sometimes. Occasionally, hospitals become the source of diseases, for example, like antibiotic-resistant microbes, or in this case, it becomes an epicenter for the coronavirus. I'm curious how a supposedly droplet transmissible virus spread so aggressively through the hospital. Was it their cleaning standards, their standards for treating the infected patients, their isolation standards, or is it some issue with the hospital's air, cooling, and heating system? In my last update, I mentioned all the countries South Korea gave travel warnings for, which included Vietnam. But with such an enormous leap in cases, maybe they should explain it's for everyone else's safety. So this year will pose some unique challenges for travel. Your decision to travel is your own, and I can't decide that for you. I have a link below for the official travel warnings from the U.S. State Department, which now includes cruise ships in Asia. Again, I encourage everyone to have travel insurance that covers health and flight cancellation. Also, wash your hands with soap and water for at least 20 seconds, and this helps prevent the spread of germs and viruses like the coronavirus. And do that frequently. Many are suggesting not to wear a mask, but in my opinion, having an N95 mask that fits and is worn properly is useful in many situations. Usually, I suggest packing light when traveling and not worrying so much about hygiene items because you can just get them in country. This is not my opinion at this time. Consider bringing extra hand sanitizer and disinfectants. The fluid limit on airplanes can make this challenging. A big concern of mine has been being quarantined in the country I visit, but now I'm also concerned about being quarantined when I return home. So this is one more thing you need to consider. Also, there's now a chance of flights being canceled in general. I'm currently in Vietnam. When I return to the States, I have a layover in South Korea. What if that flight gets canceled because Vietnam bans travel to Korea? That just might happen to me. Also, if you decide to not travel and stay at home instead, stock up on a few essentials like canned foods or dry foods like rice or something, something that you would normally eat, and drinking water if you need it. Just in case there's a scare and it's near your area, the supermarkets will most likely get cleared out. So just sort of preemptively stock a little extra, okay? It'll just save you a trip to the supermarket, all right? I'm not suggesting anything crazy here. It's just, an extra bag of rice and some extra canned food. It'll tide you over for a week or so, okay? All right, thank you so much for watching. I hope you found this helpful. Give this video a like and subscribe if you're interested in travel videos. Have a great day.